Next on our special feature on seniors is Shane Hall. He started a franchise called Select Home Care, and he is the director, the corporate director of Select Home Care. Thank you very much, Shane, for being on with us today. Really appreciate it. You're in 6 different states now, correct?
That's right, yes.
So you have a pretty phenomenal background in home care, actually.
Yeah, well, I'd like to think so. I mean, it's close to 18 years now, and I've seen kind of the whole spectrum from a very, very small office to an international healthcare company and some things in between. So I feel like I've finally landed in that perfect spot in terms of providing the very best services to both our community and the elderly.
I hear people constantly interchange home care, home health. Can you explain the difference?
Sure, yeah, there's a big difference. We love to work with home health agencies, but we're not a home health agency. And really the biggest difference is caregiving services, so assistance with activities of daily living, which is what we call home care or caregiving services.
Bathing, toileting, they're there as long as you want them to be.
Correct, that's right. And traditionally in the privacy of their own home. And then there's home health, which is a skilled service typically covered by their private insurance or Medicare, things like that.
Right, so it might be a nurse who comes in quickly and examines, or a physical therapist.
Yep.
So very different as far as the support and the amount of time
exactly.
that somebody spends
right.
with you too.
And we work together a lot because traditionally the nurse, therapist, whoever it might be, is always saying or being asked, hey, can you help with a bath, or can you do some grocery shopping for me? I'm out of food.
You're like, no,
no. But that's the perfect transition for us to kind of work together, and they can say no, but we don't do that, but we know a company that can.
Right. Now, home care has changed quite a bit, especially in California. I know some of the other states have jumped ahead of us in the way of licensing and that sort of thing, but California, as of January in 2016, this year, came up with some new ideas of how we should be running home care.
Yeah,
so share that.
For as progressive as we say we are in California, it's bizarre that it's taken us this long to institute licensure. So that's right, as of January 2016, you have to be licensed to provide home care or caregiving services in the state. And so we're using that to our advantage and making sure that everybody knows that they should be referring to and using licensed home care agencies.
And they should have a licensing number,
right?
Correct? I don't think the website's quite up yet, but eventually you will be able to go on and check the license against the name of the agency, correct?
That's right, just like a contractor.
And why is it important to be licensed? What are the things that they're demanding that you do that the unlicensed person probably wouldn't do, or a broker even? That's another option.
Well, it is an evolving process, but so far what I can see is the thing that I like the most is that it's about people. Always has been, always will be. And so identifying the very best people out there and making sure that they're on our team has always been really important for us. But that's kind of what licensure is doing also. They're saying, hey, we're requiring a Department of Justice background check, and if anything comes up from the first day that they run that check to 10 years down the road, they're going to let us know immediately and say, hey, pull them out if there's a significant enough issue. So for me, in our agency, that's probably the thing that we see that is the greatest benefit so far.
Creates more safety.
Yes.
The other thing too, I know that some agencies, prior to licensing, they're really not properly insured. So it really creates a danger having these individuals on your property who could potentially be injured, and then there's no backing by the agency to protect the senior or the family from some of these episodes.
That part of it has been a real eye-opener over the years, but what we've seen a lot recently as well in conjunction with that is things like unemployment insurance. You know, when they're using a private worker or an independent contractor, they don't realize that they're by law and by definition the employer. And so if they ever
have to pay taxes,
yes,
too, right?
And if they ever make a change, like the caregiver's just not working out or whatever, and they need to make a change, then they let that caregiver go. That caregiver can file unemployment, and then EDD is wanting to know where all their payments have been, and then of course they get in touch with the IRS, and it's kind of an avalanche from there. So with a full service agency like ours, and that's a mandate through licensure, they have to have all of those things in place. They have to hire the caregivers as employees and not independent contractors.
Excellent. Shane Hall, thank you very much for being on with us. How would somebody reach out to Select Home Care if they were interested in talking with you about your services?
The best way to reach out to us is our website, selecthomecare.com, and thank you so much for having us. We really appreciate it.
Absolutely. It's important for people to have good care, so I appreciate what you do.
Thank you.
Thank you. Up next, the importance of long-term care insurance. How to use it, why to use it, when to use it. We have expert Joan Brannon on with us next.